We have a joint work group meeting, I guess, initially here to talk about some federal grant application issues. There are, for everybody, people in the workforce work group, there are packets and nameplates kind of behind over here. So if you want to sit there, you're certainly welcome. You can stay where you are too. Either way is fine. But your packets are back there. So if you want to grab your packet, that's where you can find it. Welcome to the committee or to the work group.
Mr. Chairman, thank you, Birgit. Thank you.
So we just wanted to talk a little bit about the exchange planning grant.
Sure.
There should be a letter in everybody's packets of. So a few of us sent a letter to the department and to all three departments actually, asking for an update before the September 1st deadline. A exchange application, and we've included your response back in our packet so members can see that. And we also would be interested in hearing about some of the workforce grant opportunities that are also out there as well. But I don't know if you had any preliminary remarks on the status of things?
No, Mr. Chairman, I appreciate the invitation, or at least letting me testify.
And if you could just pull that up a little closer. Yeah.
And I appreciate the legislators in this task force of the Healthcare Access Commission doing this preliminary work about what things may look like in the future in Minnesota. And perhaps across the country. The the only comment I would make that the context of any answers that I give relative to the exchange planning grant, called Planning and Establishment Grant category of HHS funding opportunities, is probably best in context with the governor's executive order that was issued on the 31st of August of last week. So in the context of that lies the answer to any question that you might have, and I just thought I'd say that. The information about other planning or grants, this is a long list. We talked about it at the LCPCP yesterday. It's a list of, from the federal health care reform bill, there's about 108 or 9 grant opportunities. This is a pretty good spreadsheet that you have distributed here. And I'd like to just give a little bit of explanation, unless you were going to, about some of these columns that I...
No, please proceed.
And I'd like to start there if I could. Just because there are grant opportunities out of federal law and with appropriations or at least authorization does not mean it all goes to state government. You will see in that category of eligible entities that these are not state government decisions about whether to apply for these grants. Sometimes it is schools, sometimes it is workforce centers or providers or education institutions. And so that is an important category for you to look at first before you have a lot of discussion about whether state government should or should not be applying for these opportunities. The rest of it is fairly self-explanatory. It is in the last column called funding announcement. This is the FOA, when HHS, any state federal grant is put on a federal funding opportunity announcement. That is usually on a website that is searched daily by many state agencies. That is a good indication. And if there's a filled column in that last column, that funding opportunity has been opened. These are actually fairly brief opportunities. Sometimes you have 3 weeks, a month, or 5 weeks to respond with an application to receive that funding for that particular category. So that is a general indicator of when that has been opened up for application for a federal grant. With that said, Mr. Chairman, I would simply only stand for questions.
Senator Bergman.
Mr. Chairman and Commissioner, I'd like to just kind of continue the discussion that we had yesterday about the rationale the governor had about that there would be other opportunities to apply for planning grant monies for Minnesota for planning and exchange. And I don't believe that you're right about that. So I'm interested to hear what makes you think that we would have another opportunity to apply for this planning grant.
Mr. Chairman, Senator Berglund, that's a very good question. I will tell you a brief story. In June, we went as a health reform lead from the administration in an NGA, Best Practices Center, meeting in Washington, D.C. We're met with a co-sponsored organization from the NGA, the Medicaid Directors Association and the National Association of Insurance Commissioners co-sponsored a meeting with the White House and with HHS. It was at that meeting that the states talked about not having enough resources. Many states talked about not having enough resources without ever previously examining what an exchange would be. They didn't even know what a definition of an exchange was, and we're trying to help interpret the federal law about what they needed to do. It was in a subsequent meeting, I believe in early August, where the national meeting of the subsequent meeting was actually in Minneapolis, where the announcement of the $51 million in planning and establishment grants was announced. This is from Nancy Ann Parle, the White House health reform senior official, the Cindy Mann from the National Medicaid Director, officials from the Department of Labor and IRS were all at that meeting with a very small group represented by about 46 states, and that's where that announcement was made, also with a promise from the White House that this was not going to be a discount on any future planning and establishment grants, either individually or collectively, so that the major planning and establishment grants were forthcoming. The previous announced deadline for those was in March, but there's certainly a very loud and publicly promised much greater opportunity for planning and establishment grants in the future.
Senator Berglund.
Mr. Chairman.
Senator.
But you don't know when we would have another opportunity to apply for another planning grant that would do the same thing that this grant would have done for us?
Commissioner?
Mr. Chairman and Senator Berglund, the answer to that is no, I do not know absolutely specifically. They moved up this first amount of money into September when the what most states were looking at was a March 23rd deadline, which might be on this sheet or not, I'm not sure. But whether that's the new deadline for new planning opportunity grants or not, that would be a question that HHS could supply. If there was a better testifier for a lot of these questions about the actual exchange development in the states over the next 2.5 years, it would be better to have an HHS official here rather than a human service official from one state. But
well,
the question is, no, I don't know the specific answer.
Senator Berglund.
Mr. Chairman and Commissioner, with all due respect, it is not an HHS official that has decided not to apply for this planning grant. And since we don't know if there'll be another opportunity to apply for the same money, or if the next opportunity is to apply for additional money for something else, then I would say that you are failing to abide by the statute in regard to applying for this planning grant, because that is what the statute required you to do.
And Commissioner, I mean, from what I'm hearing you say, you got this indication somehow that there might be other grants, but when you decided not to apply for the grant, you don't know for sure one way or the other whether there will be additional grants authorized under this. Do you know what the appropriation is for the grants?
Mr. Chairman and members of the task force, I mean, every indication is from, this is from the White House, HHS, everybody that has any control over those federal appropriations for those planning and establishment grants have said there will be multiple opportunities in the future for just that work in the next 2.5 years for states. To the degree that the guidelines for exchange development do not exist, this is for states to explore an assessment of what an exchange possibly could look like in the category of subjects that you are, I believe, going to talk about today, about governance or regional exchanges or not, is sort of the activity that HHS was hoping to glean information from, as well as we would from other states that are doing some of that work. I don't, if you're looking for things in writing from HHS, you will find quite a hole of information about that. I mean, all these grants that don't have a funding opportunity listed in them means they have not yet found a way to, whether the grant is authorized or appropriated, they have not sent out the guidelines for those grant opportunities.
And I understand that. We don't have to, you know, dwell too much more on this. I mean, I think the difference here between that grant and all these other grants, and there are similar situations because we did include in our law last year that you have to apply for a series of other types of grants.
That's correct.
Is that the law actually, I mean, the legislature actually directed you to apply for these grants. There is, you know, apparently some wiggle room in your perspective with the language of one or more grants. I think we would disagree with that, and we were all in the room discussing, you know, the bill that the governor actually signed and then has now changed his mind. But I think the frustration is until you actually have that in writing saying that there's going to be another grant, it would seem like to comply with the letter, if not, and then the spirit of the law, that this grant should have been applied for, and to be consistent with the legislative intent. And also in members' packets, there is the draft of the grant application. Clearly the department had some idea that this money, $1 million, could be used, and there'd be plenty of things to work on it. And one of the other options, something we're going to be talking about today, is whether we should develop this basic health care option or not, which we haven't spent any time in this state looking at. The department, from my understanding, has recommended that there be a significant amount of actuarial work to do to understand what would be the best option there. I would think that this $1 million grant money could have been helpful to accomplish that purpose. So both from a perspective of the legislature, you know, whether you complied with the law is this question, why we wouldn't take advantage of the $1 million to do this exchange work is an entirely different question. Clearly there's $1 million or more worth of work to understand and do this the right way, and I think it's in everybody's interest that we do that, and I think that is our frustration. Representative Huntley.
Mr. Chair and Commissioner, there's been a lot of interest in selling insurance across state lines, and there's been talk about multi-state exchanges. How are we going to be able to keep up with what the other states around us are doing while they're planning for these if we don't have the planning money? Commissioner.
Mr. Chairman, Representative Huntley, well, I can assure you that Commissioner Wilson from the Department of Commerce and Deputy Commissioner Regala Munson have had conversations with many insurance commissioners across this nation about just that subject. The idea of what an exchange should look like, whether it be a state-run, regionally run, or defaulted to a federal exchange, is a very important questions, very important issues that will be resolved over the next year and a half or so before we start to actually do the establishment, if we decide to do it at a state or regional basis. The other problem with this is, and I can tell you that at this Minneapolis meeting, I asked both the HHS and White House officials to the group whether we could get any indication, for example, for the Utah exchange. There are 2 current state exchanges in operation, one in Utah. Actually. And, well, California's agreed to do it. Washington is going to do it. The 2 that are actually operational are Massachusetts.
Washington has already started too.
That may be true, Senator. But Utah is a very simple one. It's run by 2 state employees and a $400,000 appropriation. Yes, it is a very slimmed down, defined contribution exchange that can handle transactions. Is that an example of what an exchange to be able to provide a marketplace access for healthcare products, whether it be in the state or in a region, is an interesting, very interesting question relative to how comprehensive the Massachusetts connector is as an example of an exchange, which most people thought was contemplated in the passage of the federal health care reform. That's a fair question to ask, and without any guidelines about whether that has any scope or ability to be eligible for a certification of a state exchange is a very simple question of which we have absolutely no answer.
Well, Mr. Chair and Commissioner, Utah is a very unusual state. They basically have one insurance company that handles all of health insurance. So obviously they can have a slimmed down process, unlike most other states.
Thank you, Mr. Chairman. And I might just add, I just came from a presentation about the Utah Exchange last Thursday, and they are adding all the features to it. So the next step, they intend to be administering the tax credits for the small businesses. They indicated when individual subsidies would be available, they would be administering those too. They actually have two exchanges, one for individuals and one for small businesses. And they're talking about studying whether to bring those together or leave them apart. So they do plan to use their exchange that they have in Utah to do the things that the federal law anticipates. So I don't see why having this question answered is a problem for us in Minnesota in terms of our thinking about how to go forward.
Senator Olson.
Thank you, Mr. Chair. I just wanted to make a couple of observations or comments. The first being that I don't understand the logic behind arguing on the one hand that this is going to be a complicated process, and then on the other hand, arguing in favor of delaying funding to begin that process. It seems to me that the more that's involved and the more complex it is, the more reason for us to get going with it and to take advantage of funding that will help us work our way through this process. But my second comment is to express to you a grave concern, not with regard specifically just to this issue, but more broadly what I've seen for the last 4 years since being in the legislature. And that is a total disregard for the idea that we have three different branches of government that are supposed to be working together in cooperation, and all of whom are responsible for following the law. It seems to me that time and time again, I've seen examples, specifically and especially sitting on the healthcare, Senator Berglund's healthcare budget committee, when the department has not agreed with something that's in the law that has been specifically directed to do by the law, that it just simply doesn't do it. And I think something is really broken in our government if we have one branch of the law that is unilaterally making decisions in violation of the law and just going its own way as a maverick and disregarding the fact that, well, it may feel that it doesn't like a particular law for whatever reason, or doesn't like what the legislature or the courts are doing or have decided that is within their scope to decide, that somehow it's okay to just say, well, we don't agree, they're wrong, and we're going to do whatever we want to do. There's something wrong in government when that kind of attitude is taking place. So I really would encourage you, and whether it's you making the decision or someone directing you to make the decision, to look again to our Constitution and the way that we are supposed to be working together and try to come to the table with us to help us figure this out.
Mr. Chairman,
Commissioner.
Senator Olson, well, I strongly disagree with your statement. Obviously, there's no cavalier approach to the law by either the governor or me or any member of this administration. That, in fact, that is our job, is to execute the law. The interpretation of law is sometimes a problem, and the velocity or expectations of timelines are sometimes deemed unrealistic, sometimes by a guess, either by the legislature or by the administration. And that is the live time process by which we engage the legislature and the healthcare committees and budget committees about those. We are fairly transparent, I believe, this administration throughout, about what we're able to do, what we're willing to do, about the execution of the law as we interpret it. Courts have defended that. We don't need the courts to defend that. We believe this relationship is good. We have a budget that is balanced in full cooperation with the legislature and the governor. He signed this law. He has said by even this executive order, if you have not seen a copy, we have copies of the executive order relative to this, that in that category, it's a fairly easy interpretation of state law that says the legislature, unusually so, but the governor signed the bill into law to mandate a state agency to apply for a whole variety of federal funds. It isn't that we concede that. We are also saying that is exactly what our job is, and we will apply for those federal fund opportunities. This exchange grant, which is, I know, the controversial one right now, today, is about interpretation of whether there are future funding opportunities or not. And I'm telling you that there certainly will be.
Mr. Chair?
Senator Olson.
Commissioner, I'm sure you're familiar with the concept that if there is any question about what's intended by the law, which we don't believe there is in this case, but if there is, then you're supposed to look at the legislative history because that is controlling. Now, you have the members of the legislature who were involved with this, and I think the record is already clear, but we're here to tell you our intent. So it seems to me, again, I would encourage you to work with the legislature, follow the legislative intent in passing this law, and move forward as was the intent of the legislature when the law was passed.
All right, and I think we're going to want to wrap, but Senator Lynch, did you have? Go ahead.
Thank you, Mr. Chair. And Commissioner, I wanted to share the concerns that have been outlined with regard to the exchange, certainly, but from the perspective of the work group that Representative Liebling and I are co-chairing right now on workforce development in this state, this issuance of the executive order is particularly concerning, and I was very disappointed. And frankly, I'm not really sure where to start. It was very surprising to me because it wasn't all that long ago, just in February of 2009, when the state of Minnesota, under Governor Pawlenty's leadership, graciously accepted federal stimulus money. And at that time, Governor Pawlenty said, well, it's now the law, and we have the responsibility to deploy it and use it. Fast forward only a matter of months, and I guess something has changed in the air. I'm going to use my time to talk about Minnesota's largest private employer, not surprisingly. I think the Mayo Clinic has been very forthright, very candid, very transparent, frankly, very vocal in their concerns with regard to this latest action. And it comes on top of, and I think that's important to look at the cumulative effect, it comes on top of the rejection of early enrollment for Medicaid. This on top of that, for that one entity, which is our largest private employer, at a time when we continue to struggle with jobs in our economy, alone represents a $25 million loss to that entity. And the clinic, and in the statement that it's issued, indicates that this decision impacts the viability of this economic engine for our state. I think that's one premier prime example. I think there are countless others. In a testimony that we heard in our work group earlier, we heard from the University of Minnesota. We heard from Minnesota State colleges and universities. You've outlined here a number of funding and grant opportunities available to them. We were disappointed to learn that in most cases, the institutions don't feel that they're able to apply. And they don't feel that they're able to apply because they don't have the funds in their coffers to be able to put on the table simultaneously. So there are probably numerous examples that could be brought into this discussion. I'll just point out in closing that we did not hesitate to accept federal money to help our veterans' homes. We don't hesitate to accept federal money when the Minneapolis bridge collapsed. We didn't hesitate to take money to help with housing. We didn't hesitate to take federal dollars to help support Minnesota's new statewide rail plan. And we have even graciously taken money for preventative health and health services blocks grants. So I think in terms of precedent, this is a bit surprising. It's very disappointing. And if you're alarmed by nothing more out of this discussion, or let's not forget that while a large focus of our discussion today was on one particular component of Minnesota's Health Reform Act, it has far more longstanding repercussions to the state of Minnesota.
Mr. Chairman, if I may, just for a second, Senator Lynch, I appreciate your comments. Reviewing the fact that the Mayo Clinic leadership did praise the governor today or this morning about his decision to accept the FMAP enhancement of the stimulus bill as well. The understanding about this decision about one funding grant opportunity, whether that is a decision about universal health coverage in Minnesota, is not the point. It's whether or not the exchange dollars and the planning and establishment activities of this state will be consistent with what is going to happen in 2014, and whether that is a good idea, and it is whether the state should invest its resources on that as the rules of the game continue to change. I'm saying that at the same time that Senator Ron Wyden, who a well-respected U.S. Senator from Oregon, is advising his state, for example, my counterparts in his state, to seek a waiver from the federal health care reform bill because they don't want to establish an exchange. Interesting developments are starting to develop over time about how people are viewing the entire federal health care reform. It is federal law. It's not going to be repealed in the next several years. That's not the debate. We have 7 sources of funding in the Department of Human Services. 4 of them, ongoing for a long time, have been federal monies. Medicaid matching, TANF funds, child welfare funds, and SNAP funds, or used to be called food support or food stamps in an earlier age. We also have other sources of money that we have to care about and protect as well, one of them being the general fund of the state of Minnesota. So those investments of time, energy, and resources about what we should be doing with our time and activities within any administration are important decisions. The governor has made a decision and triaged. His executive order is a process announcement, which every agency does comply with, for him to be able to make better decisions about these grant opportunities only relative to the Federal Health Care Reform Act. That is what it is. And that is what it is. The executive order and the letter that I sent in relative to that one grant.
I assume you consult with the governor whenever you think about applying for a federal grant with the governor's office, the department?
Excuse me?
When in the past, when the department's going to apply for a federal grant, there's communications with the governor's office in general about whether to apply for the grant or not.
Mr. Chairman, that's a good question. In general, that is true. I should tell you that some of the work, Senator Lynch, you should know this too, that some of the workforce development to grant opportunities, even in the federal bill, are on their way. Those applications are on their way. That was talked about with the governor before the executive order. The background check funding opportunity was sent at the behest with knowledge from the governor at that time too, without that much formal process. But there's quite a few grants, and some of them are not in the $1 million categories.
And I guess my question is, are you familiar with an executive order being blanketly issued preemptively on a whole series of grants, previously? I mean, that seems what's very strange about this one, is that the governor decided with this group of grants, I'm going to execute a kind of a preemptive executive order on doing these instead of I mean, because he could have taken them one at a time as the grant opportunities came up and had the conversations instead of issuing this blanket order to the department not to apply for any unless he approves. I mean, that's one of the things that seems a little bit surprising about the strategy he employed here. And I don't know if you have any, you don't have to make any further comments about that, but it just seems kind of turning on its head the process we've used before. Senator Berglund has one more question, then we're going to move on. So.
I actually have two more.
Or two more. Senator Berglund has the floor, and then we're going to move on.
Better put, Mr. Chair.
The first is in regard to the workforce planning grants. And my understanding is that our institutions of higher learning don't feel they have the matching funds to be able to make the application. But our Department of Health has some state funds for workforce. And so I am just wondering if this blanket order would mean that the Department of Health would not be allowed to talk with the University of Minnesota or any of our other higher education institutions about partnering to use our existing state appropriation as perhaps a source of matching funds so we don't lose out on this opportunity, since we know we aren't going to have enough workforce in the future in healthcare regardless of whether the federal act is repealed or not repealed. Do you know whether that would it
Mr. Chairman,
apply to
Senator
that kind of a partnership?
Very interesting question. First of all, I'll interpret that as legislative permission, as it were, for us to explore that possibility. And I don't think the Department of Health can answer that question right now, but it's.
Well, I'm kind of wondering about this blanket. We are not going to apply for anything that was appropriated in this federal act.
Well, that's certainly not what the executive order says. There's 85% of these grants have not yet had a funding opportunity announcement, and so they will be triaged as they come.
Well,
those that are required by law will be applied for.
I, for one, would encourage this type of partnership that I've been describing here, because we can't really afford to leave any federal workforce dollars on the table for lack of having matching funds when the state does appropriate some state-only dollars in another area. We should try to maximize that opportunity, I think.
Just to be clear, Mr. Chairman, Senator Berglund,
Commissioner.
that process can go forward, I believe, but it would also fall under the queuing of the executive order, in my estimation. But I would have to check with the governor about that.
And then the second thing that I'd just like to say, and this is really just a comment, the state of Maryland used the entire $1 million grant opportunity that we are passing up to apply it toward trying to figure out how they could go about setting up an electronic eligibility system as part of an exchange. Now, if the state of Minnesota had done that, I would have been in 100% support behind it, because we have spent way more than $1 million, and we have taken over 8 years, and we haven't been able to accomplish this yet. And so I am a little leery about whether in the next 3 years we'll be able to accomplish this, and whether we'll have any money from the federal government to pay for it. So I think there are ways that the governor, the executive branch that assists the governor, could have looked at this funding opportunity differently than they did. And we could have taken advantage of that money, and not in a way that would have necessarily given any support of the governor to the version of an exchange that he apparently thinks the federal government wants us to create, but to rather do something that we've been trying to do anyway, unsuccessfully so far.
Mr. Chairman, Senator Berglund, thank you for not mentioning the project's name. I appreciate it.
Okay. Thank you for coming, Commissioner.
Mr. Chairman, we do have other folks from my agency, Department of Health, to answer, I think, some of the questions that your staff had sent to us earlier, more technical in nature, if you need them.
I think we're going to, well, we have a lot of other work to accomplish, but thank you for that. members, we're going to move actually to, oh, we're going to move right through. Oh, yeah, we need to, do we, okay, we're going to adjourn briefly. Or take a recess. Senator Lynch.
Mr. Chair, for members of the Workforce Working Group, we will reconvene upstairs in room 107 at 2:35. And if you could bring your materials with you to room 107, that would be helpful.
Again, they're likely to be back here if you have them. Thank you. So we're going to reconvene in 2 minutes.
Let's get going.
Letting people leave the room.